Hi everyone, welcome back to our channel. I'm Dr. Amal from City Skin Clinic, and today I thought I would chat with you about all the ways that Botox can be used, and I can tell you there are some obvious ones and a few that might surprise you. The aim of this video is really to just give everyone a wider kind of perspective on Botox. I think it's still something that has a lot of stigma and there are quite a lot of myths about it, and as you know, with this channel we try and do a little bit of education and just in a kind of light-hearted, good-spirited way. If you're interested, please carry on watching this video, and if you're new to our channel, welcome. If you're returning, then welcome back, and I hope you enjoy this. So Botox, you've probably heard me speak about it in previous videos, but just as a quick summary, Botox is a drug. It's a neurotoxin that acts at the nerve muscle junction, and it basically paralyzes muscles, and depending on the dose that you use, this can be completely freezing them, or it can be just reducing their movement. And so it comes useful in many ways where we want to reduce muscle activity. And it's important to bear in mind that when muscles aren't active, they shrink down, so they atrophy. And this will explain why Botox can be used in certain things like jaw slimming and that sort of thing. So there's obviously the traditional, most well-known use of Botox in cosmetics, which is as anti-wrinkle injections. I'm not going to labor on about anti-wrinkle injections because I've talked about it in previous videos, but this, in this situation, you most commonly inject Botox, usually in the forehead, the frown line, around the eyes, and what that does is it freezes, or if you want a more natural result, it relaxes the muscles that pull on the skin to cause wrinkling. So in that situation, we're using Botox in its traditional cosmetic use, which is as an anti-wrinkle injection, and what that does is any wrinkles that are brought on by expressing your face, so if you have the 11 lines here, when you frown they appear, then Botox is fantastic for that. The same with crow's feet or smile lines around here, and the same with the forehead wrinkles. So it's fantastic for that purpose, and it's quite well known and well used, and in good trained hands you can get a really good natural looking result. So based on its this kind of use for cosmetics, there are a few other ways we can use it in that department. So one of the most obvious ones is the non-surgical brow lift, or the Botox brow lift or chemical brow lift. We use it a lot in our clinic, sometimes alone, sometimes with fillers. What you're doing is trying to stop the fibers of muscle that pull down excessively on the brow. And so you just try and relax these a bit, and in return that gives you a nice lift to the brow because the muscles aren't kind of pulling it down, and so that can help with very mild hooded eyes. It can help if you have a droopy brow, and it just helps to open up the face quite a bit. And I've done a video on non-surgical brow lift options, but that's another emergingly common use of Botox. One thing to bear in mind with Botox and using it in this way is it's about having a light, sophisticated hand so that you get an elegant lift, but you don't get kind of a weird shape to your brow. You can gently and subtly reshape the brow with Botox, not to the same extent as fillers, but it's very good for these uses. And then, after that, there are some other uses that you may not have heard of so much. So one of these is actually, again, going with the facial expression stuff. You can use it in people who sometimes when they speak, the nose tip goes up and down and that bothers them. You can use a tiny bit of Botox to just relax that area there, and that kind of lifts the tip of the nose. It stops it from moving up and down, which for some people is not something they like, and they feel subconscious about. And along that line of thinking, we also have Botox for gummy smile correction. And again, I've done a video on this, but gummy smiles are when people smile, the muscles pull excessively on the lip, and so the top lip moves up, it looks really thin, and you just see excess, sort of you see the gums. Again, it's not like with the nose tip moving, it's not dangerous, there's nothing wrong with it, but for some people, they're quite self-conscious about it and they don't like it, and Botox can offer a really good, simple solution for this. Botox is also fantastic for reshaping the face. So for people who have a really wide jaw and a square face caused by excess muscle size of these muscles here, the masseters, that help with chewing, Botox injection in this area can really slim it, so you end up having more of a V-shaped face. It's also a dual purpose, so often people will come for slimming the face with Botox, but they also suffer from tooth grinding, and that is a really good treatment for tooth grinding. In fact, it's a really good treatment for tooth grinding even if you didn't want to slim the face, but beware, as a side effect it will do that, because that grinding causes these muscles a really good workout, and so they get quite huge. So these are like really good uses and common uses of Botox, and in the right hands they're quite safe. Along with the lines of reshaping the face, again, sometimes when people have a small chin, the muscles kind of pull the chin upwards and try to compensate for this. And so you end up with perhaps a crease around here, you end up with maybe pebbling of the chin area. The chin might be tilted forwards, and for some people they don't really like the aesthetic look of that. You can use Botox in these muscles here, and that will help relax the muscles, and that can reduce any pebbling. It can also help reduce any crease here, and it can just open up the chin a little bit more than rather have it pulled up that way. In those cases, you know, you can combine it with dermal fillers to just reshape even more, but it's good for that purpose as well. And then before I get off the face, so these to me are the main uses of Botox in the face. There are times when you can use it a little bit to help with jowling and with marionette lines, but to be honest, in that area, dermal fillers are much better, or a combination of Botox and fillers. And oh, one more thing, one of my favorites, vertical line correction or smoker's lines. Again, Botox with fillers offers a really, really nice, elegant treatment for that area. Moving on to the neck, really there's the fantastic non-surgical neck lift that targets a muscle that's kind of a remnant from evolution. We don't use it anymore, but that when you use Botox in that area, that causes the neck to sag less, and it makes it look a lot more sculpted. It gets rid of vertical bands as well, and we can also modify it a little to help with early jowls as well in that area, and that can really help tighten the appearance of the neck and improve the sculpting of the jawline. So these are fantastic cosmetic uses of Botox. Some of them, as I mentioned, have a dual purpose as well, like the tooth grinding Botox. And then there are some other non-cosmetic uses of Botox that are really also quite useful. So the big one is hyperhidrosis or excess sweating. Most commonly people have it in the armpits, the groins, the hands and the feet, but you can also, and we have treated in the past people with hyperhidrosis in the face area as well. And in that situation, you're using Botox not for its muscle activity, but its effect on the sweat glands. And there are some people who also use Botox for the same reason, but I've done a video on this because the evidence of them, but there is a possible effect on oil production by the oil producing glands. So in some cases it's been used for acne, but I would say the evidence isn't there in the same way that it is with hyperhidrosis, where it does treat hyperhidrosis that's caused by excess sweating and not caused by another medical condition. And then there are lots of other, like remember Botox, before it was used for cosmetic reasons. It was developed, there were medical reasons for using it. One is to help people with stroke and even out the asymmetries. Also in people with stroke or people with cerebral palsy, where you have a kind of tightening of certain muscles and a difficulty with walking. You can use Botox in the muscles, for example, on the leg to help improve that. Botox can also be used for bladder spasm as well. It can be used in a medical sense for also things like anal strictures, and so instead of having surgery that has really complicated side effects, Botox can help relax those muscles and treat that condition. So there is an awful lot to Botox. It's just important to know that first and foremost it's a medication, it's a prescription drug, and it has fantastic possibilities, but it has to be used in the correct doses, in the correct locations, by someone who's trained and knows what they're doing. Anyway, I really like Botox for a number of reasons. I think it has not just revolutionized cosmetics, but it has helped a lot in other cases, especially in cases of movement disorders and stuff like that, where this has been used to help, and in stroke rehabilitation. So it's a useful medication. I think it's always interesting to share beyond what we know about Botox. If you have any questions about Botox and any of its uses, or any experiences you want to share, please leave a comment below. I will leave some pages that I think might be interesting for you guys about Botox. If you enjoyed this video, please give it a thumbs up, and if you're not a subscriber yet, please subscribe to our channel. Until next time, stay beautiful.